All right. We're going to wait a little bit until more people come in. They are coming in. And then we go ahead and start. All right, it's 2:01. Let's start with this webinar. Good afternoon and welcome. And thank you everybody for joining us for our 6th installment of Pandemia, the series of webinars dedicated to bring you information about COVID-19 and COVID-19 vaccination. This is a collaboration that we have Latino Commission has with COVID-19 Prevention Network. And my name is Luis Mares. I'm the Director of Community Mobilization Programs at the Latino Commission in New York City. And today I'll be the host and the moderator of this webinar with the students and presenters. So are we there yet? Reopening our society. The title says it all. We've been living in this pandemic for over a year and 3 months already. And we have seen vaccination happening in different speeds, for let's say it, in different areas of the country since December. So we started this vaccination thinking or aiming or willing that we should vaccinate at least 70% of the population of the states to reach the herd immunity and then open society and go back to the new normal that we want to have. So we are in the process and we are in the middle of this and we still haven't reached those numbers. On June 22nd, the latest report says that about 177 million people in the United States, which is 54% of the population, have received at least one vaccine, and 46% of the population is fully vaccinated. That's 150 million people in the States. But it's not the same for everybody. It depends on the ages, it depends on the ethnicity, it depends on the location where you live, what state you live. In terms of age, the older the population it is, the more vaccination they have received. The younger population has been vaccinated as much as the older population. But also ethnicity has a factor, a relative factor in this. Not everybody who has been fully vaccinated has provided information on ethnicity. Only 62% of the people that are fully vaccinated. But this shows that only 25% of the Latino population in the country has been vaccinated, an even lower rate for the Black community. So being these two communities, the ones that have been hit the hardest with the pandemic, why aren't we receiving vaccination at the rate that we need, right? So there's many factors and we're gonna see that today. Also the states, it depends on where you live. Only 16 out of 50 states in the country have reached at least 50% of vaccination, fully vaccination in the communities. And most of these states are located in the Northeast and in the Pacific coast. So what happened in the middle of the country, what happened in rural America? Why are we reaching better numbers of vaccination? There are many factors. The lowest vaccination rates are in the South, Mississippi, Alabama, and Louisiana, which is, we know that the health system in those states have been historically not the best ones in the country. Florida has 44% and California 48%. Why I'm saying this to Florida and California, because our two amazing presenters are for those states today. They are going to talk about their experience with vaccination in the Latino community, and the challenges they have found, and what have been doing, what needs to be done still to reach the numbers that we expect. So to talk about this today, we have two presenters, as I say, one from Florida and one from California. We're going to start with Dr. Stephen Fallon, our first presenter, PhD, co-founder, and serves as the Executive Director for Latino Salud, a minority-based HIV/AIDS services organization serving the region with the highest new HIV infection rates in the nation. The agency's representative gay Latino staff members provide free HIV testing, STD screening, PrEP initiation, prevention, education, and outreach, case management, youth and peer leadership programs, and linkage to care services to the most at-risk population from the South Florida locations. Previously, Dr. Fallon directed HRSA's National Hub for Technical Assistance to the Ryan White community, the Target HIV Center. In his commitment to public health, he has trained staff, developed boards, written grants, evaluated programs, and facilitated community health forums in 42 states. Dr. Fallon's research has appeared in the Journal of Acquired Immune Deficiency Syndrome, AIDS and Behavior, the Journal of Urban Health, Open for Infectious Diseases, and in community publications such as Positively Aware magazine. And Latino Salud, as the organization, has also been providing COVID vaccinations to the community in these past months. So, Dr. Fallon, you can go ahead.
Thank you for that wonderful introduction, Louis, and thank you everyone who's tuning in. As Louis said, this is part 6 in a series, and I am probably just going to jump in at the wrong spot because I'm going to talk about all the way back to the beginning and going forward, but we'll go through it quickly. One of the things that I had assumed was that vaccination would become the school bell that lets everybody out for recess. But I'm finding, and perhaps you are too, that in your client community, in your general community, maybe among your staff, maybe in your own mind, the before and after vaccination may not be a world of difference for you. So we're going to discuss how people perceive the epidemic and how agencies, perhaps like yours, may have dealt with or are dealing with the epidemic. So I'm going to share my slideshow here. As Louis said, we're asking the question, are we there yet? Meaning, are we back to normal life with COVID-19 vaccination and society reopening? What has changed? Has it been an incremental, almost glacial change, or have we shot forward? Well, what I'm going to do with my short time with you is I'm first going to rewind all the way back to the beginning of the epidemic, because let's face it, we're all feeling that hum of anxiety in the background. We feel like there's a specter of something's wrong, you know, not necessarily, oh my gosh, I'm going to get COVID, but oh my gosh, somebody I love is going to get COVID. One of my clients might suffer from COVID, or oh my gosh, I'm going to have to defend myself for wearing a mask or not wearing a mask or arguing with somebody on the other side of this public health issue. All the way back to the beginning, we were dealing with imperfect information. That means incomplete information. We didn't know everything we should know to address the pandemic properly. And unlike in the old Back to the Future movies, we can't jump ahead and then go back in time and do what we should have done because we just did not have perfect information. What did we know? We knew that first there was rising number of deaths, very rapidly rising. Um, we heard in the prior administration, we heard claims that this will all just go away, repeated 40 times by the prior president during a period of time where we got up to 400,000 deaths. So there's no wonder that people were feeling like this is with us to last. Even more than just deaths, though, the course of the disease can be horrific for those who suffer the worst of it. So horrific that most of us kind of forgot that about 80% of the people who are infected with COVID will have no symptoms whatsoever. And 90% will only have either no symptoms or minor symptoms. But we were all laser focused on what was in the headlines, what was on our TV screens: horrible illnesses, people wheezing and choking, and deaths. So our alarm bells all went up. It's only human. And we were also lacking very exacting information. We knew basically it's airborne, but it might be surfaces as well, but we did not know. Looking back now, we probably overemphasize what they call tensile transmission, that is over surfaces. This virus doesn't seem to do that very well. So we were probably, perhaps over sanitizing everything. Some numbers, if you haven't heard this before, that might be helpful to you. COVID-19 does not mutate very quickly. Yes, there are mutations. Yes, we want to get control of this virus so we don't spin out more dangerous variants. But overall, COVID mutates at about a rate half that of the flu, or about a quarter that of HIV. So it's not going to suddenly become the alien from the sci-fi movie and take everybody out. But we didn't know that then. All of you who are joining this webinar right now, you all work for clinics, community-based organizations, aid service organizations, and you're all dedicated to your communities. And you know the vulnerabilities of those communities. You know which people are lacking information. You know which of your members don't have easy access to healthcare, can't afford healthcare, are dubious of the healthcare system. So of course it's natural, rewinding back to March or April of last year, that you are very much focused on how can I keep them safe. And given how little we knew about, is this very transmittable or only a little bit transmittable? Are those horrible courses of illness and deaths really only the minority, or are they going to be the majority in the minority populations I deal with? There's a lot of people scared. And as a result of this, there was a sort of a fear of what I'm calling touching the third rail. What is the third rail? It's the number one thing you don't do. If you're in government, you don't mess with Social Security. End of your career. If you're in public health, the worst thing you could do would be to be seen as contributing to the spread of the pandemic. Nobody wants to do that. So the instant decision from almost all community-based aid service organizations around the nation was close the doors, close the doors. And I'm going to share a different perspective here, but I want to explain up front that I'm going to share different rationales, but none of this is a retroactive judgment on whatever your organization did or did not do. We were all doing the best we could. We were all guessing and filling the blanks. What may be useful, I hope, is that seeing perhaps a different path could be useful for you to think about how you reopen, even if you did close. So what did closing do? Well, closing immediately avoids what I call the vigilant threat. What do I mean by that? We were highly vigilant. We were highly attuned to the threat of COVID-19, almost to the exclusion of everything else. Close the doors, we can't be blamed for spreading COVID inside our offices. End of worries. But we asked ourselves at Latino Salud in South Florida, but what might be lost? Certainly we can get on webinars like this, we can put messages up on social media, but it's not the same as those flesh and blood contacts that we have when people come in our doors. So we may, if we close, lose some opportunities to address other health concerns with our community members when they're so isolated at home. With regards to COVID-19 specifically, we may miss out on some opportunities to debunk myths that people have about COVID vaccines. Yes, we can put a social media post up that says what you heard on XYZ AM talk radio is a lie. Who knows if people are going to see that social media post? But people coming into your office for another service, that's an opportunity. That's a teachable moment. And on a more general level, by protecting clients and blocking them out from our agencies to prevent contagion, we may have been consigning them to isolation and anxiety, which may have triggered other health issues, maybe slipping back into substance use, maybe issues with depression and mental health, maybe just not keeping up with their other health care, taking their medications on time. For all these reasons, some organizations said, even though we can't come in that human contact like in this photo here, we are social creatures, and anything we can do to try to get closer to people gives us a better chance, perhaps, of helping them. So the question we were asking ourselves at Latino Salud, with no better information than anybody else, believe me, can we stay open? And the question for all of you today is, can you reopen? So I first want to, this is the busiest slide I have for you, and it's small font, and apologies for that, but I want to show you when Latino Salud decided we are going to stay open. We meant we're going to stay entirely open for individual level services. Of course, group level meetings took them online. But how do we stay safely open? Much of this will be familiar to you, but I want you to have the opportunity to screen capture or get the slides after to see what we did. Maybe you can inform me if we skipped something. And if you see something that your agency didn't do, you can use this. So going back to March, April, May last year, we were coming in early to sanitize our entire facilities and then staying late to sanitize them again. And very important, most of us live in, work in what we call sick buildings. They're so sealed that the air gets trapped. So we were airing them out daily. We were also rotating staff, and perhaps you did this too. We let some staff work from home, and on alternate days, they would come in and they would work on site. The goal of that was to reduce ourselves down to skeleton crews in each of our locations. So each staff member had at least 400 square feet to themselves. Very few staff on site. Now, what's the view from the client side of the door? Well, the doors were locked. We were open, but not wide open. Knock for entry, and I'm sure you did this next. The 3-question survey about, are you symptomatic? Might you have COVID? And the temperature checks at the door. Staff masked up, masks given and required of all clients. And we're not open to debate on this. You're more than welcome to go somewhere else if you don't want to mask up when you come in for services. We were at that time, and this is our level 3, these are our strictest protocols. We were max 2 clients at a time in a 2,000 square foot building. Then get out till the next 2 can come in. Within that, we didn't want those 2 clients, unless they arrived together, we didn't want them sitting together, opposite ends of the building. And as I alluded to before, no groups. So groups were by Zoom. After every encounter, whether a Ryan White encounter, or a STD screening, HIV testing, PrEP initiation, whatever it was, everything sanitized. We were distributing personal protective equipment, both at the individual level to where you came in the door, and also at the community level to the drop places that perhaps clients who aren't coming to us could find these things. Now let's move to the staff. We have fewer staff on site dealing with more protocols and, frankly, a little worried. We don't know for sure if this is 100% safe. So we sought out outside funding, and from some generous supporters, we were able to institute hazard pay, $2.50 an hour additional for 4 or 5 months. And you may well have done this as well. And then also on staff, we couldn't meet for staff meetings in person, but we started doing check-in meetings. And these meetings had no agenda with regards to, how are we meeting our deliverables, or what's the staff situation with onboarding a new trainee, none of that. It was all just, what are you feeling? How can we help? Completely open. One of the things you'll learn, and you probably just saw it there, when people pause, there's a feeling like something's wrong. I have to say something, right? We let silence become comfortable. If nobody said anything for 10, 12, 15 seconds, that's okay. And then we would invite them. Tell us what's really on your mind. We had some staff, for instance, tell us that their families were upset at them for continuing to work at Latino Salud. They thought they shouldn't be there. We had to mitigate that. So these were our strictest protocols. This is level 3 protocols. Now, I want to show you a video. I know that showing a video through Zoom and back, sometimes it'll get a little choppy. It's only a 2-minute video, but I'd like to show you what was the methods and ways in which we institute these protocols and what was the reaction. So enjoy this 2-minute video.
La gente se impactaba al escuchar que Latino Salud estaba abierto. Latino Salud siempre estuvo al margen y mantuvo siempre su visión de ayudar siempre a la comunidad, y más aún en tiempo de pandemia y de la gran crisis que estamos viviendo hoy en día.
So we are seeing a new group of people, especially with our new PrEP clinic. There's a lot more interest in the community to access the services.
Tuvimos un cliente que necesitaba su medicamento ya que era reactivo, y gracias a que estuvimos abiertos estos días, él pudo conseguir su medicamento. Así que sí veo necesario que estén abiertas las oficinas para poder seguir ayudando a nuestra comunidad.
Varias personas fueron beneficiadas y pudieron adquirir sus medicamentos para tratar las enfermedades de transmisión sexual y el VIH. Es por eso que me siento feliz de formar parte de esa gran familia de Latino Salud.
Besides my health, I feel that I'm absolutely grateful for having an opportunity to help others. In this time and age when everything is being shutting down and everything is so uncertain, knowing that we can make a difference is something to be grateful.
It is easy to lose sight of the things that we have lost during these times, but it's important to still, while practicing social distancing, to go outside, be with your loved ones, as long as you're in a safe space. I think that's very important, just to remind yourselves that there are things that are good going on in the world and just to keep moving forward, because that's all you can do at the end of the day.
In this virtual world, I can't see it, but I hope you're all cheering for those amazing staff members who stayed in touch with the community and tried to make not just people healthier, but people feel connected. Now, as the pandemic went on, things started to get a little bit better. The incidence rates of COVID went down somewhat. We went to our level 2 protocols. Much stayed the same. If you see something in green, that's something we changed. So we were now comfortable just sanitizing the entire facilities once a day. A few things we dropped away. We no longer were on skeleton crew. We were okay. We have sufficient spacing between desks for people who work on site. Many of these other things stayed the same. We now allowed 5 clients at a time. In our main building is 2,000 square feet. Our smallest building is 1,700 square feet. So 5 clients at a time. We were starting to approach the fall season and coming up on the holidays. The hazard pay ended, but again, I see this as just a job of an executive director. I went out and got special monies to give what I think was a really generous holiday bonus. In recognition, people stepped up to serve the community more than usual. This should get a special recognition. And I mean, money is just one way to recognize people, but I tried to make it as generous a recognition as possible, hundreds to thousands of dollars per staff member, and continuing the Zoom check-in meetings. Now, some people watching this might already feel like, well, we're not even ready for level 2. It's still scary out there. Everybody has to come at their own pace, but I'm going to throw out a teaser thought to you that maybe we're over risk sensitized here. Maybe we're so focused on what we're hearing in the headlines that we aren't recognizing the relative risk might be very small for this client or that staff member. Don't let down your guard entirely, but what do we know? We see this. Some agencies and perhaps some people they were so focused on risk that it led them to think almost in a PTSD way, under panic rather than planning. Here are the facts. You've probably heard in the media that after 2 weeks following a full course of vaccination, the risk of acquiring COVID or being hospitalized drops very much in the 90s and higher percentage. Actually, even that is a misleading number. Why is that? Because saying the risk drops relative to a person who wasn't vaccinated. But remember, not everybody who isn't vaccinated is going to get COVID. So there's not a 0 to compare to on the other side. So we have to look not just at relative risk, but true raw numbers. And what we saw is the actual rate of infections among people who are fully vaccinated is just 0.5%. And I'm sure you've been hearing on the news lately that those who do have what they call breakthrough infections despite vaccination, extremely rare for them to have severe symptoms, extremely rare to be hospitalized. Some did pass away despite vaccination, and the numbers just out today, you probably heard 1,200 people nationwide out of 850,000 with severe course and 600,000 death from COVID. So the risk is far lower than what the headlines sometimes lead us to feel. Part of the reason the risk is lower is because we're working towards herd immunity. No, we're not going to make the July 4th target of 70%, but we're getting there. With every communicable disease, you can't catch it if nobody has it to pass to you. You need an infected host. And this graphic, which I did not create, but I found it very helpful. I hope you'll enjoy seeing this. The blue shows people who are unvaccinated, and the red shows the infections that can surge through a community. The higher percentage of people who are unvaccinated, the more red you will see go through. So your community may be well shy of 90% or 95% vaccinated, of course. You don't want to let your guard down entirely, but maybe your agency is 90 or 95% vaccinated. If that's the case, I'd suggest you don't have to live like the people in the upper left-hand corner as if you are under constant threat of COVID. For people who are vaccinated, and even to some extent for those recovered, they're less likely to be both currently infected or contagious. And finally, I want to share when we got to where we are now, our level 1 protocols. Eventually, these will fall away, but we're not ready yet for that. So most things are still the same, but something that we alluded to at the start of this webinar, Latino Salud became a Florida-registered, Florida-shot site and began first vaccinating all staff. And we did require that. There was some debate about that, but you're allowed to require that, and it's a business necessity since we work in health. Once we had vaccinated staff, we moved on to offering free vaccination to the clients and the community. Just a little plug for my staff again, we received no grant support for this whatsoever. So everybody's working harder. Everybody's like Lucy in that graphic down the bottom, going as fast as they can, but they're doing it because they want to help the community. And frankly, the opportunity to get a free vaccine, your choice at our agency, we're doing Johnson & Johnson and Moderna, that brings people in who may not yet have been focused enough to come in for their resuming their STD testing or their Ryan White case management or their HIV testing. They come in for the vaccine, they get those other health services at the same time. We let staff take their masks off when they're in their offices, put them back on to make clients feel comfortable, but the staff, again, are fully vaccinated. Just in the past month and a half, we have resumed the option of live group meetings. People can still Zoom in if they feel safer that way, and we do socially distance, but we have found people just so relieved to be able to look somebody in the eyes. It's such a fresh change from just Zoom meetings. And we had our first live staff meeting on April 26th in 13 and a half months. So all of this has meant a more hectic pace, more pressure on our staff, but all in service to our client community. I wonder if your agency is already at level 1 protocols, or if you're not there yet, whether you feel with this reopening, you're almost ready to go there. How can we get to the other side? The theme of our discussion today, as Lewis introduced it. Yes, when we change things, when we take away some of the restrictions of the COVID-19 pandemic, some people will argue with us. When we keep the restrictions up, some people will argue with us, why are you wearing a mask? But some will appreciate. I was so proud. This was the first year that Latino Salud was named best of by our local newspaper, South Florida Gay News, in both counties, as a matter of fact. It was amazing. So if you're getting to the other side, if you're starting to release some of those safety protocols, our suggestion is make sure that your wording isn't loaded when people come in the door. I'll give you an example. If I ask you, well, are you vaccinated? That sounds like a judgment. It's almost like when we talk about HIV stigma. If I ask somebody in a more indirect way, have you had an opportunity to get vaccinated, or did you want to discuss vaccination? It's less of a finger wagging in their face. The first way, are you vaccinated? That's a loaded question. The second or third way, more open. And respect individual choices. Yeah, unfortunately, it's also true what you hear in the media. I do see that in my communities of color, I'm more likely to bump into people, whether at work or at the gym, who harbor doubts about the vaccines, who aren't going to get vaccinated. All you can do is plant a seed. Don't try to argue somebody into it and tell them why they're uneducated. Just plant a seed, and maybe they'll come around. And then for yourself as well, maybe you were living in that high vigilance state, right? And it might feel a little unnatural coming back. Everybody has a different definition. I just started taking my mask off at the gym about 3 weeks ago. But by contrast, my sister, who's been fully vaccinated for months now, she just went to the supermarket for the first time in 14 months. Everybody has a different starting point, and knowing that they have a different starting point, we're all going to have to relearn the process of walking normally through society. And we want to appreciate and respect each other on that. So let's reframe the question of reopening. Don't just ask, hey, do I dare reopen? Am I ready for the community? Because that's based on the question, what do I risk if I reopen? I would suggest we should start thinking about, what do I gain if I reopen? What does my community gain when I reopen fully? And I'd suggest to you that this might be what we regain. This is staff and members at the start of this weekend's Stonewall Street Festival and Parade. And the pride on those faces, the colors of those flags really show what we've been missing for 14 months, community. Thank you all for everything you do out there. As you come out on the other side of this pandemic, make sure you have your own self-care as well. For myself, this is my self-care right here. When I get to travel internationally and see beautiful places like this, whatever is your inspiration, whether it's a new restaurant, whether it's an international trip, whether it's seeing your family, put that on your calendar and look forward to it. Be healthy, keep serving the community. Thank you so much.
Thank you very much, Stephen, for reminding us the feeling that we had at the beginning of the pandemic and how difficult it was for many of us to maintain social distance and how hard it was to many of our organizations to take the decision that closing the services that we provided to our community. Services are very important, like you were mentioning, HIV testing, patient navigation, et cetera, et cetera. And I'm sure many other organizations of all organizations like ours in New York are already reopening, in the process of reopening and going to the other side that you mentioned. Thank you again. And so now we have our second presenter, Dr. Ian Shapiro. He's from California. He's from Mexico, actually. Lives in California. Dr. Ian Shapiro is working in Altamed since 2015, and during this time he has made a significant impact on the organization and the greater communities that it serves. Dr. Shapiro is a tireless advocate for healthcare equality, with a deep affinity for innovation and public health policy, especially related to the Latino population. Currently, Dr. Shapiro serves as Altamed Medical Director of Health Education and Wellness, helping to create and implement programs and services that expand access to care and improve outcomes for the community. Between 2016 and 2017, he also served as Medical Director for Behavioral Health and was instrumental in strengthening the practice and expanding Altamed's offering and created the Employee Health Department, serving more than 3,000 team members. During this pandemic, the coronavirus pandemic, he moved the entire outreach and education department, use digital and online platforms for groups, visits, and long-term care of social determinants of health for the community, creating high-touch, high-impact models with an amazing team, integrating services from food needs to social support and advocacy for the patients involved. So, Dr. Shapiro, the floor is yours. You can start presenting.
First of all, thank you so much. It's an honor to be here. And Dr. Fallon, I'm ready to do the self-care with you. You know, those places look very interesting. Then I hope to I hope that we have many more trips and other amazing things to actually advocate for ourselves also. Familia, thank you so much for being here with us. And let me tell you why I'm here. I am done, and yes, I'm wearing a white coat, but in reality, the magic that it's happening in our communities is not here. And I'm going to tell you where I think we're supposed to be going to. We have seen right now in the past months how difficult it is to have a communication with our community, how difficult it is actually to put everything in front of us. And most importantly, we have seen, each of us, how much our community has suffered. And a lot of people went directly with me and go like, Dr. Shapiro, well, okay, tell me about this. Then we have had this virus and everything that it's actually moving towards us. And it seems that, you know, this was kind of genetically created to destroy our communities. If you compare, you know, like different communities, the, you know, communities of color, especially the Hispanic community, has been severely damaged because of this. Why is that? Is it our genetics? Is the virus? Was it what? And in reality, the problem is, and it's called social determinants of health. When you push a community to the extreme, to the point that, you know, the environment around our communities, it's not the best one. We live near highways. sometimes it's very difficult to actually get to actually a healthcare provider. It was historically very difficult to have a telehealth, conversation with a doctor. If you needed to go to a doctor, you needed to choose between food or actually being seen or taking care of your diabetes, or who is going to bring food for your kids. Then there were a lot of things there. Plus, you add depression, anxiety, and of course, we still have a lot of things regarding nutrition. Then we start having these little pockets of there's food, but it's not the food that will actually make us work and be better. The best example that I can actually give you is that when you have a car, you have two choices. You need gas and oil, right? And you need to do the changes. If you put like bad gas and you're not changing the oil, the machinery will run and the car will run, but it will be slower and it will not go that far. The other way around, if you put high quality, oil there and you're doing the changes and you're moving it, it will go faster for a longer period of time. And that's what happened to our community. At this moment, we were not having a lot of oil changes. And sadly, the gas that we were taking was not actually one of the best quality that we had. Then you have all these things cooking here, and you add the COVID-19 pandemic. You stress a little bit our communities, and the word resiliency goes out the window. Why? Because and probably all of us are done with the word resiliency. Right now, we need to start changing the concept of resiliency, that it's kind of biting a bullet between our teeth and just waiting and getting all hit, like all the punches without actually punching back. Why? Because we want to have a healthy, growing community. We want to have something bigger than just being resilient. Right now, we saw already what happens with resiliency. It blows in our face, to the point that here in LA County, a lot of the majority of the ICUs at the top of the pandemic were occupied by Hispanos. That's heavy. On the other side, we have all this crazy stuff that were happening, and we were praying, and Dr. Fallon actually talked about this. We're praying for a miracle, for something to punch back. And yes, we had the social distancing, we had the mask, we were actually washing our hands like crazy. Our hands were actually like purple from all the cold water and soap that we had. And it got to a point that, we were just hiding. Right now, our prayers were answered. We have 3, compared to other parts of the world, we have 3 vaccines that are safe, effective, and are changing the way that we live. Pfizer, Moderna, and Johnson & Johnson. And with that, well, we're like, yes, we can start the process of the light. Like instead of just hiding, we can see the light. But guess what? We had issues. We were calling, yes, I want the vaccine, but they answer in a foreign language. Or yes, and we didn't have internet. Go to the internet. Don't worry, it takes 2 minutes, and you go to the internet. And first of all, you need to get internet. The other one actually was an issue because most of the websites started in your own language, probably Spanish, and ended up in English. Then why do we need to do all the whole thing? And the other thing is, okay, no worries, we'll start like operators. And at the beginning, we start like cleaning all these barriers that we had. And yes, it has become very easy right now compared to the big, like 2 or 3 months ago, to actually get the stuff that we are having. And it's important at this moment that we actually reflect on that. We're getting to a point that, a lot of people go like, well, why Latinos were we're actually having all these problems at the beginning of the pandemic. And right now we're having, they have the option to get vaccinated. They have the option to do absolutely everything. And we're not getting the vaccine. And we start with stories. And this is actually where a lot of the storytelling part gets interesting. We start with stories like, no, they're hesitant. No, they want this. Oh, no. And yes, there's a lot of fear, and I get it. We need fear. Why? Because when we were actually fighting against lions, tigers, and I always joke about dinosaurs, fear is good. It's a survival instinct. The thing is, you need to put that in the context and put the information there. You know that the lion was there and it was going to eat you, or you need to fight back. And with COVID-19, we're fighting against disinformation. Then the fight is different. You have fear, but you need to actually, cover your points and making sure that you're getting the correct information to not just for yourself, but everybody else. But guess what? We're essential workers. We're going out there. Then we have 2 or 3 jobs. We're trying to make a living, and suddenly you get snippets of the information that your comadre or compadre, your friends are sending to you, and suddenly you have like these weird videos of things poking and flying, and you're like, Dios mío, that's not something that I want my kids or anybody to have. But we never ask why. We never ask why those videos were actually just for entertainment purposes, as I call them, rather than actually something real that we need to take decisions with that. Part of the things that we have for the future is that part, having that conversation with our communities, making sure that our communities get the opportunity to do that part. And right now we have, almost free on-demand cars to get you from one point to actually the vaccines and go back. And we're moving forward. We're making sure that you have daycare. There's a lot of movements out there that are making it easy for our entire community to get vaccinated. The thing is, 3 things. One is that a lot of our community members haven't heard the message yet. And what's the message? Esto es gratis. Es para todos y no importa que tengas documentos o no. This is free. This is for everybody if you have insurance or not. And it doesn't matter if you're undocumented or documented. ¿Por qué digo eso? Why am I saying this? Because at the moment that we understand that part, that the virus does not distinguish, where you're coming from, who you love, what do you do, what do you like to eat, what's your language. This virus actually attacks absolutely anything that it's human. We are the only machinery that this virus needs to procreate. And right now we do have the vaccine to start closing the door. What's going to come on the next following weeks? And I'm going to tell you 2 stories. One is making sure that we're closing the door as many possibilities for this virus to change. Why? You already heard from Dr. Fallon that the virus usually have like 3 options. One is that they go inside of us, they use our own cells to actually replicate. It's not that they have like a machinery and they go to Fiji and they have like this special secret hideaway. No. We are the hideaway. Then they go inside, they start changing. And option 1, the COVID-19 actually reassembles, doesn't work, bad, it's destroyed. Logically, sadly, it hasn't happened because we still have a pandemic. Then that hasn't happened. The second one is that, and thank God this one hasn't happened, is that it becomes more lethal, meaning that the mortality rates can go up, it knows how to kill us faster, and that's a problem. It hasn't happened yet. Possible, but not yet. The third one that is kind of shifting there, we're hearing, right now, the Delta part, the Gamma part, a lot of different things that the COVID-19 has become. And it's not that it's a living thing, but the way that the COVID-19 thinks is that I want to attack as much people as I can and make sure that, I'm very fast. And because the more people I contaminate, the more people actually shed my sons and my grandkids and you get the point, the entire family. And exactly that's what's happening right now. We're in a verge where we're, especially here in the US, where vaccine rates are going up, cases are going down, and that's amazing because that's the trend that we were seeing, and it correlates with the vaccines. And thanks God right now, the vaccine, at least they actually fight a little bit against, well, not a little bit, but they do a good fight against the Delta variants. But what's going to happen? If this virus continues to replicate, not only here in the US, but in the world, we have had, other viruses, and we know what's the outcome. We can start rolling back slowly to the point that we were before. And that's something that my familia, I do not want to get there. I will fight with my teeth in my closet and absolutely everything that I have to make sure that that doesn't happen. But we need all the mighty power that we have here. Why? Because we have a second thing. If at this moment we start helping our neighbors, making sure that everybody else around us are getting the opportunity to get vaccinated, helping, our abuelitos, abuelitas, our partners, our loved ones to get vaccinated and have honest conversation, because it's okay to be afraid. It's not that everybody, they go like, and at the beginning we were like, oh, you don't like the vaccine? That's life-saving. Anti-vaxxer, go away, go away. We're far away from that. It's okay to be afraid, but we need to actually open the conversations, making sure that we're destroying barriers and, again, create that human touch. Why? Because I'm not going to lie. When I got my vaccine, I actually needed to do a process. And part of the process, and that's the thing that we need to do in the future, is making sure that what's the data? Right now, I know that, being in Bow Heights in East LA, one of the epicenters of the entire pandemic in the US, I was seeing people dying. And I saw the horrible things that COVID-19 can do. On the other hand, I actually had the vaccine. And yes, there's side effects, pain, redness. Right now we have, other things that are popping up. Yes. But interestingly, COVID-19, the disease actually has a huge impact in our lives if you get sick. And yes, a lot of people go like, whoa, I'm organic, I'm a marathon runner, I have never touched meat in my life, and I meditate every day. That's awesome, but COVID-19 doesn't care. That actually, it still can go inside of you, and still you can get sick and end up on the hospital. You have more possibilities of surviving. I will give you that 100%, and actually most of people will survive. The thing is, right now we're having 50 different symptoms on the long term for COVID abnormalities. Then it's extremely important at this moment that we start having those honest conversations with our communities. I will take 2 more minutes before my friend Luis starts like punching me on the side to close this up, and I really want to hear questions and answers from the entire community. Then one of the things that we need to put out there is that we have the choice. We have the choice to start closing in. We need to make sure that right now we're having a lot of issues for young people to actually get vaccinated, and a lot of them are not getting the information in their hands. It's not that they feel bulletproof. It's not they like facts. They like to interact. And right now, the information that it's out there in social media, it's not helping us a lot. Then we need to go out there as trusted sources of information and start conversations. I see myself and all of us in the healthcare system as waiters. That's the way that we need to be perceived, and that's our job. We need to go there with a menu. This is what we have. And with the menu, we need to make sure in the future that we tell them what we know, what's our recommendations. And sometimes they will go like, no, that I'm deadly allergic to that one. Or, you know what? I have never tried that one. Let me give that part. But at the end of the conversation, and that's where the magic ends. And actually it starts like, well, actually where the magic starts, it's where, when they walk out, they need to be happy with the decision and at peace with the decision that we're having. For me, that peace, for me, my family, and everybody else around me is extremely important. And that piece is the way that we are right now vaccinating our communities against fear with a dose of truth. And I hope that with all the things that we're doing right now with the Latino Commission Against HIV, with amazing, with the Latino Salud and everything else, that's amazing for us to put the word out there that we're here, we are represented, and we need to make sure that we're breaking barriers as we have done historically to not just create resilient communities, but an amazing future for our community. Thank you very much. Thank you, Dr. Fallon.
Thank you very much, Yelan, for your presentation.
I love the waiter analogy. I'm stealing that.
All yours.
Always very passionate when you present. That's what I like when I see you presenting. So there's a few questions. Let's start with Stephen. your organization has been providing vaccination to the Latino community. So I don't know how long I know you presented it, along the way you register as an organization that can provide vaccinations and you vaccinated their staff. So what challenges you found with our community, the Latinos, in terms of getting vaccinated? When they went to ask questions, what there were doubts, what questions they asked, what was the most difficult part of getting people vaccinated?
Well, thank you for that question. And Louis, by the way, thank you to the Latino Commission for inviting our little organization to participate in this discussion. It's so important. We have two different views really of vaccine hesitancy or acceptance. Because if you look in our doors, we only have a clinical provider in 2 afternoons a week, sometimes 3. So we're always full. We have vaccination scheduled every 5 minutes and it's always full. Many of them are our primary target population, the Latino, gay, bisexual, MSM community, but many of them are just people who found us on either Google reviews or on the Florida Shot site. So we have families coming in. So if I look only at my doors, I think this is great. The Latino community fully is embracing positive steps towards what we call health-seeking behavior. Then I look at the nosy, pushy busybody at the gym, at the bookstore, at the wine cafe, who's always suggesting to people, hey, did you know we offer vaccines? And I do encounter people saying, oh, no, I'm okay. Oh, you got your vaccine? I learned not to ask that anymore. Some of them aren't ready. I'm seeing it less common that they believe the outright lies. You know, remember in the beginning, the CIA is planting a microchip with nanotechnology and the vaccine to follow you. If they want to follow me, they already can. And I paid $1,200 to let them follow me. So, I mean, good gosh, how stupid am I? But I don't hear that much, but I do hear people saying, well, I'm just not sure. They came out with the vaccine too quickly. And again, remember I spoke earlier about just planting a seed? Say, well, yeah, this vaccine, it did come out more quickly. You know, so there's probably reasons for that, but just let me ask you, when will be enough time? Just tell me your date, or just think about it. You don't even have to tell me. How long how many people have to be vaccinated, or how much time will be passed? And then just come see us whenever you're ready. We're always happy to help. But giving them a question rather than a fact will probably convince more.
Thank you. Ilan, you mentioned that LA was the epicenter, New York was the epicenter at the beginning too, and I saw also people, the trucks with the bodies on the streets. It was very, very disturbing to live that experience. And I'm a marathon runner, but I got vaccinated as soon as I could. And you mentioned something very important what people don't know. It's like, yes, you might survive, but there's long-term effects of COVID-19. And I think one of the fears that people have with vaccination is the long-term effects of the vaccination that nobody knows. We don't know, it's true. But we know now that COVID-19, the disease has long-term effects and that people is not very well informed. So thank you for mentioning that, Ilan. So I hope people learn about this. I mentioned at the beginning that minorities are not being vaccinated at the rate that they need to be vaccinated. So Ilan, what outreach strategies do you recommend to help increase vaccine uptake in these communities?
Right now, we need to go out the old way. Get promotoras out there, promotores out there, door to door. Right now, it's not that, you know, our community is proven that we, from all communities of colors, the Hispanos want the vaccine. The problem is that there's a lot of things, and I don't want to call them systemic barriers, but there's a lot of issues there. There's like walls and tornadoes and a hurricane coming up. Then we need to make sure that we bring umbrellas and we try creating all the pathway and bridges for our community, and that's on top of us. They don't care about the government. They don't care, you know, like I love Dr. Fauci, but you know, it's foreign for them. Us as trusted sources of information and community leaders and community clinics and churches and everybody that in taco stands, you know, we need to be there to make sure that we amplify the voice of, and Dr. Fallon said it perfectly well, start the conversation, put the seed in, making sure that we open the door. And I always tell them, like, I don't get chocolates. They don't send me flowers. I don't get a new, no, I'm doing this on the conversation part just to share. Then if you need information, I'm here. If you don't need anything, that's okay. I will always be here. And the same thing as the waiter, we will need to be here for our communities.
You both mentioned social determinants of health, which is very important in our community. Before the pandemic, we were already going through disparities, and this pandemic made it more evident. Like, what things can we tell our authorities, our legislators, our governors, we can suggest and tell them in order for increase the vaccination rate in our community? For example, the lady who does the laundry downstairs here in Queens, New York, I asked her, "Have you vaccinated?" And she said no. And I asked why, and the answer is that she did think about it, whatever, but she fears more that she's going to lose one day of work because of the side effects of the vaccine, or she doesn't have time to go get vaccinated because she has to go to work. And this is the type of population that we have. Our Latino community is the front workers, the people who have to be working every day because they need money to eat and survive. So what can we tell authorities about these things? Both of you.
If it's okay, I need to run because they are my boss is waiting on the other line. Then I'm going to do it quick and shiny here. Is that we need all the power, not from here. The vaccines will get it. We started with only English, and right now we are actually sending Ubers for them. You know, like we are advancing that part. Right now we need to think about the future. If this happens again, we don't need to talk about resiliency. We need to talk about healthy family members that, you know, they have mental health services. They know where to get help. They are eating the correct thing, and most importantly, the environment is just for them. And that's what we need to be talking about our you know, any government official, because if we leave them open, and sadly, if we continue the same thing, our next pandemic, because yes, there will be more pandemics, we will have the same results. And that's the thing that we need to be asking them, that they have the choice to mitigate, to make sure that we, instead of burying people, we actually need to make stronger people that will actually get sick, but they will bounce back faster. That's not resiliency. And that's the conversation that we need to have for the future. Dr. Fallon, thank you so much. Luis, thank you so much for the opportunity, because I know that we were bouncing ideas for months. I'm very happy to be here, and I'm always here. I already put my information in the chat, and thank you for the opportunity.
Dr. Shapiro, great to work with you. Terrific information, but I'm very mad at you because I thought I do get chocolate.
So sorry. So
okay.
Nos vemos.
Thank you, Len. So we still have for one more question. You mentioned that we shouldn't be judgmental, and we have to accept people's decisions in terms of getting vaccinated or not getting vaccinated, which is true. And I think most of us have been practicing that. So what would you tell somebody who doesn't want to get vaccinated? I'm sure you have many people, and you talk about the vaccine and say, no, I don't want to. For whatever reason they have, what do you tell them? And to plant the seed that you said.
Yeah, it's kind of not what you tell them, it's what you listen to. And I'm probably the worst at following my own advice, but use these more and this less. Just let them keep telling you their reason and ask follow-up questions, and maybe they'll start to notice some of the weaknesses in their own thinking. But I also think there's something we can do rather than just trying to convince those who might be the hard convincibles. We can remove barriers. And what Dr. Shapiro was talking about, which is so important, those promotores going out into the community, or with my staff, we can only go out into the community occasionally, but here's a simple thing you can do: stay open later. So many agencies down in Florida are at the front lines of every letter writing campaign. Policymakers need to change this, policymakers need to do that. And then they close up at 5 o'clock at night. So when can your clients get to you? I don't want to shame anybody, but maybe put in your next strategic plan to think about having at least a couple of nights a week that stay later to serve the community, those people who are working 2 jobs. And then I don't want to embarrass one of my past staff members who's on this participant list right now. He said, make it like a pizza truck. Just when it's there, people will do it just because it's convenient. I think that's great advice. Be there to meet people. Thank you to everybody who's on this webinar for all you do. I hope some of this was helpful to you.
Well, thank you, and thank you, staff, actually, for the job that the work they have been doing during this time and working through the pandemic and delivering the services that they are so much needed, and that many times in many places were like closed down for a while. And it was like here in New York, everything was closed for a long time. And one of the things that you mentioned is like opening the longer time or opening on days that are not supposed to be open. This is what a New York City Department of Health is doing with vaccinations. We have 24-hour vaccination centers for that, especially for those people who work the day or are waiters and get out of work like 1 in the morning and they can go back to that time. And that's how it's done. Thank you very much, Stefan, for being part of this webinar. And Dr. Ilan, who left already, thank you too. And thank you everybody for being with us today. It was an amazing webinar. I'm very grateful for your presence here and grateful for your participation, Stephen. Thank you very much.
Thank you, everyone.